Hi, you guys. Welcome back for our daily practice questions. It is day 173 and our Pharm series continues. But as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminders that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. But before we get started, don't forget to hit the subscribe button so you're not missing any of my videos. And if you would like to gain access to my MP Test Success Toolkit, it is free and linked in the description. The link to my website is also in the description, and it shows you all of the resources that I offer, and it's broken down for first-time test takers as well as those who are retesting. All right, you guys, question number one states, a 42-year-old office worker presents with numbness and tingling in the thumb, index, and middle fingers, worse at night. Phelan's test is positive. What is the best initial treatment? Is it A, corticosteroid injection into the carpal tunnel? Is it B, nighttime wrist splinting and NSAIDs? Is it C, surgical release? Or is it D, oral corticosteroids? Take a moment and tell me what you got in the comments, y'all. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, what is the best initial treatment? So again, first line therapy, but you know what I always say, if they're asking for a treatment of any sort, to look and run it back and see if they provided you with a diagnosis. If you have not been provided with a diagnosis in the question, you got to run it back and look at the assessment findings so that you can determine what it is to be able to treat it, right? So we have a 42-year-old office worker, has numbness and tingling in the thumb, index, and middle fingers, and it's worse at night. Sounds like carpal tunnel, right? And then your confirmation is the Phelan's test is positive. For carpal tunnel, we do Tinel sign and the Phelan's test. And so this confirms the diagnosis of carpal tunnel. So what is first line therapy for carpal tunnel management? And it's B, right? So you can do nighttime wrist splinting and NSAIDs. Do you do surgical release? Yes, but that's not first line. Pay attention to terms. First thing you would do, first line therapy, initial treatment options. Always pay attention to those keywords. All right, question number two. A 20-year-old male presents with wrist pain after a fall on an outstretched hand. There is tenderness in the anatomical snuff box. X-ray is inconclusive. What is the best next step in treatment? Is it A, reassure and discharge? Is it B, apply a wrist brace and recheck in a week? Is it C, a thumb spike a splint and refer for repeat imaging in 7 to 10 days? Or is it D, immediate MRI and surgical consultation? Take a moment and tell me what you got, y'all. All right, so stem of the question here, what is the best next step in treatment? So again, is there a diagnosis provided? It's not, so let's see what's going on. We have a 20-year-old who comes in with wrist pain after they have fallen with outstretched hands. There's tenderness in the anatomical snuff box, and the x-ray is inconclusive. All right, so this is classic presentation of scaphoid or navicular fracture, right? It's commonly presented with that snuff box injury because you're falling, you stretched your arms out to brace your fall, and that's how that wrist injury occurs. But remember, the reason this x-ray is inconclusive because it's been done immediately after the injury. You have to wait at least a week for you to be able to see any evidence of this fracture. So your best answer is C. You want to do a thumb spica splint and refer them for repeat imaging in 7 to 10 days, just so that we can verify that it is this fracture. But you want to go ahead and splint it so you can prevent any potential necrosis. All right, question number 3. A 32-year-old postpartum woman complains of wrist pain near the base of her thumb, especially when lifting her baby. The Finkelstein test is positive. What is the most appropriate initial treatment? Is it A, NSAIDs and thumb spica splint? Is it B, surgery? Is it C, physical therapy only? Or is it D, systemic corticosteroids? Take a moment and tell me what you got, y'all. All right, and stem of the question, what is the most appropriate initial treatment? All right, and a diagnosis is not provided, so let's see what's going on. So we have a 32-year-old postpartum woman complaining of wrist pain near the base of her thumb, and she notices it more when she's lifting her child. The Finkelstein test is positive. All right, so base of the thumb pain, wrist pain, right? And then a confirmation Finkelstein positive test is classic and confirmatory for the diagnosis of de Quervain's tenosynovitis, right? So then you need to think about how you initially treat that. And so your best answer is going to be A, NSAIDs and a thumb spike splint. So I wanted to give you, the few wrist injuries, but I also say when in doubt, we're going to splint the injury. We're going to give NSAIDs to reduce that inflammation when we're talking about the first line therapies, especially with these musculoskeletal injuries, right? So pay attention to that. We're not jumping straight to surgery. You want to be able to do that symptomatic management and rest the area and watch it and make sure and see what's going on before you're jumping directly to surgery. So just think about that when they're asking you initial. Although you can do surgery for something, you're not going straight out the gate to that. Remember, least invasive, least expensive is how we progress throughout our treatments, right? So again, best answer is NSAIDs and thumb spica splint. All right, you guys. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. Everything that I do offer is linked in the bio of this channel. But as I mentioned earlier, my website is also linked in the description of this video that takes you to all of the resources that I do offer. But y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.